A very warm welcome to this special edition of Newshour. Tonight, we explore a new kind of influence taking root in Azerbaijan, where medicine, technology and diplomacy converge, with deepening ties to China and a bold health strategy taking shape. The country is stepping into a leadership role. Well, at the centre of this effort is Azerbaijan's Minister for Health, Teymur Musayev. In an exclusive interview, we ask him what it means to build not just a better healthcare system, but a regional model for the future. First, this report sets the stage.
Across Azerbaijan, a transformation is taking shape, not just in hospitals or clinics, but in how health is understood, delivered, and shared. It's a quiet revolution, led not by slogans, but by strategy. And its next chapter is being written with help from the East. Following a high-level state visit to China, Baku is now embracing an opportunity that stretches well beyond its borders, becoming a medical hub for the wider region. But how will that ambition take shape? With dialogue intensifying between Baku and Beijing, new frameworks are being drawn. One of them, turning Azerbaijan into a crossroads of healthcare exchange, where Eastern wisdom and Western science are no longer rivals, but collaborators. It starts in the country's liberated territories, areas once marked by devastation. Today, those same regions are being reimagined as centers of holistic recovery, blending advanced technologies with more traditional approaches. So what will that look like in practice? What role will traditional Chinese medicine play? And how will it sit alongside modern diagnostic tools? The stakes are rising. Technology is now central. Artificial intelligence, once a distant concept, is becoming a functional tool, able to scan, detect, and tailor care in real time. But will it deliver consistent outcomes or introduce new risks? And what of the regional picture? As Azerbaijan positions itself as a provider of care beyond its borders, can countries like Türkiye, Kazakhstan, or Uzbekistan expect meaningful access? Could Baku emerge as a healthcare destination in Central Asia? There's also the question of balance. Medical research may be critical for long-term success, but the human connection remains vital. Diagnosing, treating, and educating patients where they live, in the languages they speak, with systems they trust. So how does Azerbaijan aim to strike that balance between innovation and inclusion, between ambition and access? As the country navigates this moment of strategic health diplomacy, the choices made today could reshape the medical landscape for years to come. From geopolitics to grassroots care, this is healthcare as infrastructure, as identity, and as influence.
Well, to discuss this evolving vision for healthcare and the role Azerbaijan hopes to play in the region, I'm delighted now to be joined in the studio by the country's Minister of Health, Teymur Musayev, who's been closely involved in shaping the policy and partnerships behind this strategy, both at home and on the international stage. Minister, a very warm welcome to Newshour. Thank you so much for being with us. It's an interesting time, this, isn't it? Both for healthcare and for the country. The world watched very carefully when warm words were exchanged between President Ilham Aliyev and President Xi Jinping during the state visit to Beijing. The days then that followed, Azerbaijan was invited to participate in the Shanghai Cooperation Organization, having been awarded dialogue partner status. And then what emerged from that meeting was a strategy for Azerbaijan to act as a healthcare hub for the region. Can you tell us more about that vision?
Before getting to the main point, let me to extend my sincere congratulations to launch AnewZ TV channel.
Oh, thank
In
you.
a short period, you really gained wide viewership and prove yourself as a trustful source of information.
Thank you.
When we talk about relationship between Azerbaijan and China, we can refer to ancient time, to ancient Silk Road, actually, that helped people not just by means of trade, but also cultural exchange. It was well enough expressed in literary heritage of our national poet Nizami Ganjavi in his 12th century masterpiece, Seven Beauties, where he admired Chinese culture and people. Coming to nowadays, strong ties between Azerbaijan and China started to be built up based on recognition by China of Azerbaijan's independence in 1991, with further opening Chinese embassy in Baku in 1992 and opening Azerbaijani embassy in Beijing in 1993. Our national leader, Heydar Aliyev, paid special attention to the relation with China, and one of his first visits, international visits, were paid to Beijing in 1994. Coming to nowadays, strong relations between Azerbaijan and China built on mutual respect and strong political will of His Excellency Mr. President Ilham Aliyev and Mr. President Mr. Xi Jinping, that was expressed in two very important documents that I will mention later. And as you know, Vice Premier of the Republic of China paid visit to Baku last November during COP29 conference. His Excellency Mr. President has several official visits to China. I will mention especially the crucial document that were adopted during Shanghai Cooperation Organization Summit held in Astana last July. That was the joint declaration on establishment of strategic partnership between the Republic of Azerbaijan and China. As Mr. President mentioned, that was opening of new era in relationship between two countries. During his last visit to Beijing that took place in April, the joint declaration on the establishment of comprehensive strategic partnership between the Republic of Azerbaijan and the Republic of China was signed. So these two documents actually opened new era in relationships, and following to that process, we got official invitation by the Minister of National Health Commission of China to participate in Shanghai Cooperation Organization Health Ministers Summit, its 8th summit in its origin, and we participated and delivered the speech where we explained about the last advances in reforming our healthcare system. I want to point out that this summit was organized in highest level, and from the first moment we landed in Xi'an city, and the summit took from 26 to 28. We were surrounded by warm hospitality, mutual respect and collaborative environment there. During the opening ceremony of the summit, Vice Premier of the National Council, Mr. Liu Guangzhong, delivered the speech and pointed out especially that this is the first time when Shanghai Cooperation Organization Summit organized in SCO Plus format, when not only the member states representatives but also dialogue partner countries representatives participated, and each of us delivered speech and reports, I would say, regarding the steps we underwent in our countries to improve the healthcare systems and what is the vision of the future healthcare systems for each country. During the opening ceremony, also the Minister of National Health Commission, Dr. Lei Haichao, pointed out especially 4 main topics that consisted in agenda that we should discuss later. The first one was, of course, digital health. Second, traditional Chinese medicine. The third was primary health care. And the fourth is emergency medical services.
Very interesting. And then the choice of the liberated territories as a location, I mean, hugely symbolic, hugely significant, area that for so long was blighted by violence and suffering, now set to become this beacon of holistic health, not just the most advanced technology, but also learnings from more traditional Chinese medicine as well.
During our bilateral meeting with Dr. Lei Haichao, we discussed many topics, and we delivered, first of all, the information regarding unprecedented reconstruction works done and undergoing that in Karabakh, directed by His Excellency Mr. President himself. And we pointed out really incredible, I would say, opportunities, as you mentioned, for holistic approach for medical services. And as you know, in Azerbaijan, 9 of 11 climatic zones represented, and highland valleys are very useful for cultivating medical plants, and that very useful and very much in use in traditional Chinese medicine and traditional Chinese herbal medicine. That was one point. The second, we discussed also, let's say, high-tech pharmaceutical production, the possibility of setting up such a production in Azerbaijan. Right now, 153 pharmaceutical products are registered and in use in Azerbaijan that made in China. Another topic was related to setting up the Faculty of Traditional Chinese Medicine based on curriculum of famous international Chinese medicine university based in Beijing, and with full support of National Health Commission that can come to reality in very short time. Now we're in the process of these negotiations. Another subject we discussed, and actually we're now in a final phase of negotiation with Chinese National Center of Human Genome, that to build up here in Azerbaijan, to set up a joint laboratory, stem cell laboratory for joint research and elaborating new curative technologies. Plus, we also discussed about possibility to setting up regional center for traditional Chinese medicine that could be kind of a hub, especially for people from other countries around that could come and study this in Azerbaijan. So that can be educational center. We discussed some issues regarding primary health care service, and China integrated their traditional Chinese medicine in primary health care system that really cost effective and led to save a lot of money, because people, when they trust to traditional medical approach, they first pay visit to this kind of facility. And we were invited to visit Tanja District Primary Health Care Facility that was established in 2009 and serves for population more than 120,000 people. We've seen incredible integrative approach with also comprehensive view. I can tell you that in just a 4-floor primary healthcare facility, they succeed to deliver all the necessary services. You can be family planning, pediatric services, daytime surgery, all kind of modern laboratory services, and of course, traditional Chinese medicine center that was really overcrowded, I would say, in a good way, not, but we ask people, everyone was really satisfied. That can be a model in the future to be spread out, actually.
It's fascinating, this, because I remember, you know, when I was a child, a long time ago now, natural medicine and advanced medicine were very separate, almost in some cases sort of set against each other, if you like. And this is fascinating because this is bringing together the very best of both worlds. And I believe even artificial intelligence is set to play a role.
Of course. And I would say that, okay, we're coming from the full neglection to acceptance and now in collaboration. Because what we can say that when we say traditional or we can use different kind of terms. I don't want to mess up our viewers with this, but the main point to be integrative in a maximum way. So it doesn't matter. You have classic medical education, but if you are well informed about effectiveness of certain traditional approaches, you should use it in your practice, of course, if they have some proof. In most cases, this proof based on empiric experience, but in some cases, even with some scientific proof. So for this reason, integration of traditional Chinese medicine, that actually one of traditional methods that's really standardized. I can tell you, it can be acupuncture, traditional herbal medicine, or even some kind of diagnostic tools. So they prove to be effective. And integration to primary healthcare services could, first of all, be very cost effective. It reduces the cost of primary health care provided within the communities, and at the same time let you to provide kind of gatekeeping for those who really needs more high-tech approach for their health. You touched very important topic regarding AI, and this is something we discussed during this summit, and we should be absolutely clear that the future of healthcare systems will be more predictive, personalized, and based on big data analysis. For this reason, we should admit that healthcare digitalization is not just a technological shift. It's a cultural shift for all of us. It's more to admit that this is a part of everyday life, and AI is we recognize AI application in healthcare as another colleague that join our row, actually, because it can help us to resolve the main problem of modern healthcare system, the shortage of healthcare professionals. So implementation of AI solutions in a primary healthcare services can actually provide necessary support and actually fulfills the gap. You know, certain communities actually served by nurses, not by the doctors. So for this reason, the use of AI that can be acceptable by a few touch on your mobile phone, let's say smartphone, can let you to be in touch with healthcare system. And with all the new model, new technologies standing behind AI, new concepts that let us to provide primary touch with population that will prevent from unnecessary load of the healthcare system. Plus, it can be kind of gatekeepers that will then just redirect you to the right specialist to be most effective for the healthcare. So for this reason, AI is, I would say, the brilliant solution and the incredible chance for any healthcare. From this year, in certain countries, AI is registered as a doctor for practicing. So we should accept it, that's it. Yeah. And we should join this stream and to manage it, actually, because very important situation is regarding to put in AI in specific legislative framework to avoid misuse and avoid all kind of ethical issues that will arise actually from the use of AI doctor, let's say. And we shouldn't be afraid of that. This is for primary healthcare. AI is in active use now for radiology, for certain during certain surgical procedures, etc. That's normal. And AI is actively used for generating new drugs, new kind of pharmaceutical products. And we look at it normally, but when it comes to some kind of advice, we're afraid. We shouldn't be afraid. We should just open the hearts to this, if you ask me.
Opening our hearts to AI, yeah, it's very interesting. And clearly, Minister, you don't need to be a healthcare expert or an economist to see how this partnership will benefit Azerbaijan and benefit China. But how might it also benefit countries in the region, Kazakhstan, Uzbekistan, countries that are nearby?
The word hub is very popular now. And hub in healthcare, hub in certain medical education. And this kind of collaboration with our Chinese colleagues will let us to build up such a hub in Azerbaijan. And all the surrounding countries will benefit from that. And as I mentioned, we have unique climatic system around. So we can cultivate medical plants, we can set up this faculty of traditional Chinese medicine and be a model where we can integrate it for primary health care. And if you ask me, China have started already, I would say, like a kind of export of traditional Chinese medicine with absolute new model. In the past, okay, if you are interested, you used to come, study, but now with all the new technologies, all the kind of technological support for education, to gain the necessary knowledge of traditional Chinese medicine, to master the techniques, the diagnostic tools, etc., it actually demands very short time. But at the same time, using like a telemedicine support, you can refer to your masters that actually will stay in China, so that over this bridge they can deliver you their knowledge and experience.
And you mentioned earlier the important role for education in this partnership. Clearly there are many different dimensions, as you've laid out already, to healthcare. Thinking about this faculty that's going to grow and develop, what do you expect the mix to be, the balance to be between clinical practice and groundbreaking research?
Research always played a crucial role in advances of medical science, let's say, because without research you have no chance to check new approach, new methodology, new technology. Nowadays, as I mentioned before, the research itself, the technology for creating new drugs, the technology for creating new diagnostic tools or curative schemes is absolutely changed now. So I can tell you that in closest future, maybe in a couple of years, all new medicines will be created just sitting in front of monitor, again using of AI and specific algorithms. So for this reason, the spectrum of research, actually the profile of research will change. So we will be witnessing new research papers that actually may look right now like a bit futuristic, but with the support of big data models, they are more realistic than old research done on certain animals or, let's say, cell cultures, etc. Of course, it takes time, but it demands full integration for all the players on the market. When I say all the players, I would say all the stakeholders. I mean, all the countries engaged, institutional support, scientific support, practical bodies like primary healthcare providers or even third-level healthcare providers like scientific research institutes or national centers. But integrating in the same space, digital space, with exchange of data gained, just imagine how will increase the chance to get in the target in the closest time.
Well, Minister, we wish you and your counterparts in China, and in fact all people involved in this exciting partnership, all the very best for the future. And thank you very much indeed for coming into AnewZ to discuss it with us.
Thank you. I wish you strong health.
Thank you. Well, that brings us to the end of our exclusive conversation with Azerbaijan's Minister of Health, Teymur Musayev, from revitalising liberated territories then with holistic care to embracing cutting-edge technology and expanding regional partnerships. What we've heard tonight is a vision that merges diplomacy, innovation and public health into a single strategic arc. Well, as Azerbaijan positions itself at the crossroads of East and West, its healthcare ambitions are no longer confined to national borders. They reflect a broader intent to lead, to connect, and to define what modern regional health cooperation could look like in the years ahead. Well, as always, we'll continue to follow how these plans evolve and what they mean for patients across the region. From all of us here at AnewZ, thanks for being with us.